Welcome everybody. My name's James Georgilakis. I'm the Director of Communications and Impact at the Institute of Development Studies. Welcome to this seminar on COVID-19 and the politics of evidence in global health emergencies. This seminar is part of a series of seminars that we run at IDS, the Evidence into Policy and Practice seminar series. And it's also run in conjunction with our online short course on shaping policy with evidence. So a particular welcome to our short course participants who join us today. They're from over 20 different countries and their expertise spans policy advocacy, providing advice to governments, policy research and impact evaluation. Just to say briefly about the course, this is a 5-week course that we run. And it equips participants with the skills and the concepts that they'll find helpful in operating at the interface between policy and research, which is exactly what we're talking about today. And if you are interested in the course, it will be run again in the autumn of this year. You can reach us via email, shortcourses@ids.ac.uk, and we'll put a link in the chat. You can also have a look at our website. And we also have a newsletter in which we advertise all of these sorts of seminars that look at issues relating to evidence use. Do sign up to that to be notified of future events. So there's probably, well, arguably, there's been no greater challenge to those of us who are committed to evidence-informed policy in recent history than the global pandemic. And I really would like to thank Sarah Richardson, Group Editor of Research Professional News, who's chairing for us today. I'm sure it's going to be a fascinating discussion, and I will hand over to Sarah now to introduce our panel. I hope you enjoy the seminar. Thank you.
Wonderful. Thanks very much, James, and thanks to all of you for joining us today. So I'm delighted to have with me 4 expert speakers today for this discussion on the politics of evidence in global emergencies. So first of all, we have Annett Boaz, who is the Professor of Health and Social Care Policy at London School of Hygiene and Tropical Medicine. She's also the co-leader of Transforming Evidence and works with the UK Government Office for Science. Her research interest is in the use of research, implementation, improvement and engagement, and she recently published a book on evidence use called What Works Now. We then have Professor Melissa Leach, who is the Director of the Institute of Development Studies, our host organisation today. Professor Leach was the lead social scientist on SAGE in the UK and advisor to the World Health Organization during the West Africa Ebola outbreak in 2014 to 15. She currently serves on the World Health Organization Roadmap Social Science Expert Group for COVID-19 and the British Academy COVID-19 Steering Group. She is co-lead of the Social Science in Humanitarian Action Platform, which is a network of social scientists providing rapid insight, analysis and advice to inform emergency responses. Next, we have Dr. Lawrence Babawo, who is Senior Lecturer at the School of Community Health Sciences at Njala University. He is a member of the Sierra Leone Scientific, Technical and Advisory Group for Emergencies on COVID, and he is trained and skilled in health systems, policy, development and control of infectious diseases, environment health and sanitation. And then last but very much not least, we have Dr. Julian Tang, a consultant virologist at the Leicester Royal Infirmary and Honorary Associate Professor at the University of Leicester. Dr. Tang's research centres on respiratory viruses, how they cause disease, how they spread, and how they can be controlled. Over the last 20 years, he has developed international collaborative networks with other virologists, physicians, epidemiologists, and engineers, working in Hong Kong post-SARS 2003, Singapore during the 2008 flu pandemic, and in Canada on the first imported case of avian AH5N1 into North America. So I'll shortly begin the discussion by asking some opening questions to each speaker to draw out some of the key themes related to the politics of evidence use during periods of acute uncertainty. After around 45 to 50 minutes, we'll then move to an audience Q&A. So if I could ask you please to be thinking of any questions you'd like to ask our panel as you go along. You can submit them at any time using the question and answer function, which you should see on your screen. If you do end up posting them in the chat, I will check there as well, but if you could try and put them in the question and answer, that would be really helpful. And if you could include your name and affiliation, again, that would be a big help to our speakers. Finally, just one other reminder and piece of housekeeping, the session today is being recorded, so if you could just bear that in mind, both speakers and delegates, that would also be very helpful. Okay, so I think it's time we should move to our first question, which to begin, I'd like to ask Annett Boaz to open for us. And perhaps you could give us some thoughts on how well you think the UK government has used science to inform its response to COVID-19, and what, as you see them, are the key issues for building an advisory capacity that values different kinds of science knowledge during a period of acute uncertainty. Annett, over to you.
Thanks, Sarah. I'm looking forward to a really interesting discussion today, some great people to discuss with. So I'm currently based in the Government Office for Science in the UK, and so I've been reflecting from that perspective. My work is all about how evidence is used in policy and practice, and I've been very mindful over the years of the work that Carol Weiss has done in this area, where she talked about the different ways that governments use science advice. And the way I've sort of seen it from her conceptualization was that although the kind of media images that were projected at us of a kind of the scientists on top and setting agendas is really, we see a continuation of a model where the scientists are on tap and are being used as a really useful resource for government, but not kind of leading agendas in a way that we might sometimes see on kind of the way that things are presented to us, particularly in the UK in the media. But what I've been really interested in is what sits between the kind of the science community and decision makers in government, which is a kind of quite sophisticated science infrastructure to support decision making. So that existing science infrastructure in the UK government is about kind of science networks, advisory boards and committees, but also through a recent science capability review, departmental science strategies, capacity building to build the kind of ability of people in government departments to use research, spending plans that are thinking through what spend is going to be put out on research, and then transparency, increasing transparency about how that money has actually been spent. So I think I've been kind of rather impressed by what now exists in government to help mobilise that research and make it useful for government. Sort of at the same time, what we've seen internationally is a kind of growing body of organisations that are working at the boundaries to try and help governments better use evidence. So in the UK, we have a series of work centres that are synthesising evidence, but also helping in kind of facilitating and convening engagement between research and policy. We have learned societies who are very much promoting that agenda. And we also have kind of sort of specific investments in universities to try and help universities make the best of the research they've got. I think, though, that for me, what feels more problematic, and this is back to kind of, I guess when I first started working in government, I was thinking about how to fix government when it's use of evidence. But I'm increasingly seeing, I guess, issues with my own community in the academic world that I think we could perhaps do a bit better to make sure we make the best of the research that we do. And I know this is a controversial point of view, but I think there's a bit more we could do to show that what the boundaries are of our expertise, what we do and what we don't know on the topics we work on. I think we could show a little bit more humility about that sometimes, and also to recognise and be clearer about what there is in terms of uncertainty. And this is where the challenge comes for governments in having strategies that allow them to use all the different types of expertise that are available to help them with decision making, but also that we can acknowledge that uncertainty a bit more explicitly, particularly in context of rapid change. The final thing I wanted to say is about where I think the kind of scope is for more diverse voices to be heard. And I think as we've moved to see kind of maybe more academic engagement in recent years, we do need to ask those questions about whether we're making sure new and diverse academic voices are being brought into discussions, where in periods of rapid change, there might be that tendency to be drawing on kind of our trusted advisors and not to be thinking about who those kind of new voices we might hear from. And again, this is where having sophisticated science systems is important, where we can make that an explicit priority to be thinking about kind of new voices. And then linked to that, I guess another concern I have is where the sort of citizen voice in science has been in the last year. And I worry that we have, particularly due to the kind of nature of the crisis, the rapid amount of intervention and uncertainty, we might have lost a bit the important work that's been done to make the kind of citizen have a stronger voice in science and engagement in science. I was going to stop there.
Thank you. Very, very provocative opening. So thank you very much. I'm now going to ask the same question really to Dr. Babawo, really looking at a very different perspective from Sierra Leone. But how do you think that the Sierra Leone government has used science to inform its response to COVID-19? And from your perspective, again, the same question as to Annett, what do you think are the key issues for building an advisory capacity that values different kinds of science knowledge during a period of uncertainty like the one that we've been experiencing?
Yes, thank you very much, Sarah. You know, we want to be clear about the fact, the simple fact that what obtains, for example, in Europe in terms of science and epidemics, for example, can be very seriously different from what obtains in Africa, especially a country like Sierra Leone. And when we were kind of crafted into the advisory body, you know, I mean, in the first place, the advisory body was composed of renowned scientists, academics who know a lot of things about infectious disease and the politics of infectious disease, you know, and we have tried over the period to advise government on the issues that perhaps we put the response in its proper perspective, you know, but then we know that governments in Africa have their own agenda. Most often than not, we have given pieces of advice to government in certain areas that we are not properly adhered to. I mean, have not been adhered to, you know, because of the type of politics that goes on in Africa. But over and above that, the kind of politics and science the kind of science that has informed the present response in Sierra Leone has to do with, for example, compliance with government in decisions that has to do with scientific information. You know, the compliance level is a little not very clear in the sense that we are politically, for example, polarized. So when a particular decision is made, for example, when a particular decision is made, if that decision is, for example, not in the best interest of, say, the people who come from the north, where the opposition stronghold is, they are going to look at it from a different perspective. And they are not going to adhere, for example, to what the government says. The compliance issue acted negatively on, for example, to government as far as the COVID response is concerned. There is also a lot of public distrust, probably because of our past experience in the Ebola. Public distrust in the sense that, for example, when the Ebola struck over the period, we had a lot of other definitions, for example, case definition about what the disease was. And therefore, whatever people are doing now, whatever responses people are exhibiting now, emanate to a large extent from what we have experienced from the Ebola. So it's a mix of distrust and trust. Trust, for example, if you go to like the stronghold of the present government. Distrust, if you go to, for example, the opposition stronghold. So those kinds of dynamics are at play. And there is also serious, or a growing political polarization, like I was saying. You know, if you come from the north, anything that comes from the southeast is not good. And therefore, if people know that this government comes from that other part, and I do not come from that other part, I just look at it like just hear it, but don't adhere to it. Let us take, for example, the use of face masks, for example. That was really seriously enforced, or suggested by the advisory committee, or the advisory council, and it was announced. The social mobilization, people took it on, and you will go to some places, people are adhering to it. But you go to, for example, the opposition stronghold of, the party that was in government, people are not using it. They play around with it, and they risk their lives, and they risk the lives of other people. So these are some of the dynamics. These are some of the dilemmas, these dilemmas that we have come to grapple with. There are also a lot of, there has also been a lot of skepticism, even in the development of the policies, in terms of how, because of our past experience, is it that what these people are saying is correct? Because we have had an experience of things being said in the past during the Ebola, for example, which were not correct. So people are very apprehensive about even some of the very, very scientific pieces of advice that are being given to the population. So like I said, it's a mix of everything. It's a mix of trust, it's a mix of distrust, and that has been impacting a lot on the response. But over and above that, I would say comparatively, if you look at the scientific advisory group that was set up during the Ebola, and this one, a lot of impact has been made. We have a larger community that believe that science is the only way out. We have a lot of the population that is aware of the fact that whether you are in the opposition or not, science was the best thing to follow, even though there are a lot of politics, alongside this side. But then over and above that, also, I want to stress that even in our advice that we have been given, our committee, there are certain decisions that we have given, scientific advice we have given, which the government has not heeded to, for example. They look at it, they look at the implication, for example, of such a decision. For example, when we initially suggested that we needed to have a lockdown for a bit more of a longer period, the government looked at a lot of ramifications regarding that. They look at the economic aspect of it. They look at how, whether they will be popular after the lockdown has been lifted. We even suggested that, for example, the mosques or churches should be closed down for a period, so that we are aware. We are sure that people are not congregating and they are not spreading. That was given a different interpretation. And because this government is only in its first time, maybe they will want a second time. Some of these decisions they will want to, they will just say, okay, thank you very much for the decision, but then they go now and take some other decisions. So these dynamics have been, have been affecting the response. But over and above, I would say that science has played a significant role in the whole business of COVID response in Sierra Leone. I'll stop there for now.
Thank you, Lawrence. That's really helpful, and I think the issue of public trust in science is one that we will obviously be returning to later in this discussion. So now I'd like to move to Professor Melissa Leach and ask you a slightly different question, really around the different types of science. So from your perspective, do you think different types of science have been valued equally during periods of extreme uncertainty, particularly in the response to COVID-19? And what do you think are the implications for how governments engage with scientific guidance and for evidence-informed policy making?
Thank you, Sarah, and thank you, other panelists. It's good to follow. So I'm speaking here both from some involvement in the UK COVID response, but also involvement in the WHO roadmap, and indeed with past epidemics as an example of serious emergencies. And some of my remarks are encapsulated in a paper that I put in the chat, which has just come out. But briefly to summarize, I think we've seen with COVID a really classic example of the imposition of a standard top-down epidemic preparedness and response approach and the science that is assumed to go with it, which is largely risk-based and model-based and driven highly by mathematical models. Now, that's not to say that there have not been other kinds of science and knowledge involved, but the point is about the dynamics between them and what is dominant, what sits at the top of the hierarchy, and what happens to those other really important kinds of knowledge. So in the UK, we've had this mantra of follow the science, and yet science is not singular. And science is not and cannot be the dominant epidemiological models that we've seen repeated on our televisions. Likewise, in the WHO, the R&D roadmap does have social science groups, infectious disease modeling groups, public health groups, virology groups, but funnily enough, it's the epi-modeling group that tends to drive the show in terms of response. So what does that occlude? What does that downplay? And what are the problems with it? Well, I think the UK COVID response almost sums it up, because I think as we look back, despite the narratives of success now being put forward around vaccination, I think many would agree that the results of the UK response have been both devastating and discriminatory, and we can discuss more about why that is. And it's been very much driven by, certainly from the beginning, by these risk-based epidemiological models. And indeed, to start with, they were driven by a very different disease. They were models based on flu and previous experience with flu pandemics. So they really downplayed the uncertainties in dealing with a novel virus, and therefore the need to invest in things like a really good test and trace system from the beginning. And indeed in being serious about control. So what kinds of knowledges were played down at cost? Well, first is, I think, comparative knowledge. So from the very beginning in the UK response, it wouldn't have taken much trouble to look across to what was going on the ground in China, in Wuhan, and the devastation that was being caused. Some devastation that was being caused in Italy was a wake-up call, but not earlier on in China. There's much more that could have been learned. Likewise, there's more that could have been learned from African responses. As Lawrence has identified, there was a lot of experience from Ebola, and many African countries, including Sierra Leone, locked down early and put in place border controls from the very beginning, which were really very effective. So where was that comparative knowledge and learning? Secondly, there was a lack, certainly early on in the UK, of social knowledge, social and cultural knowledge. We saw instead assumptions like the public wouldn't tolerate long lockdowns. Well, where was the data? Where was the evidence for that? Actually, it was proved wrong, because people did begin to isolate and lock down before the government even did. And we saw a similar saga around masks, the assumption that people wouldn't tolerate wearing masks. And actually, of course, they did, and began to wear them even before the very narrow sorts of evidence that government was looking for came into play. So social and cultural knowledge, which we saw as so important, look back to another epidemic, the Ebola in West Africa, where it was only when some appreciation of social and cultural practices around burial and care began to be looked at, learned from, and crucially respected, did that initially disastrous failing response begin to turn around. So the social and cultural knowledge is crucial. The next is actually local on the ground knowledge. So Annett has mentioned citizen knowledge, but that kind of everyday experience as people live with disease, live with lockdowns, live with social and economic impacts. And what I think we haven't seen is that sense of everyday generated knowledge in communities flowing back up in an iterative way then to inform a response, despite the fact that it's in those located settings that we have the knowledge about diversity, about equity, about which people are getting sick and why, as well as how people are coping and managing with the social and economic impacts of the disease. Then we've got a whole area of what I'd call political economic knowledge, which really relates to how past and broader experiences affect people's trust in authorities and the ways that responses can and can't unfold in effective ways. In the UK, some of this, the kind of hollowing out of the economy and of health services had generated, I think, a big set of areas of distrust in government response, which were then sort of exacerbated by some of the incidents we saw around key political figures not following the rules, generated a kind of distrust. Lawrence Babawo has talked about distrust in Sierra Leone, which in itself is underpinned by political economic histories of deep inequality, of foreign direct investment, of land exclusions, dispossessions, and other things. So this is an array of kinds of knowledge. Their exclusion, I think, is par for the course if one thinks about emergency responses through a technocratic and top-down lens. I think we're seeing that repeated now for vaccination, which is being seen as the solution, but again, it's a technocratic rollout, which is only at the margins taking note of the social, the trust, the political economic issues, which are underpinning hesitancy in certain areas, but need to be addressed more fully. And I think into the future, we actually need to rethink our science advice to be much more deliberative, much more iterative, to recognize that these different kinds of knowledge offer parts of a complex picture, and we need to find ways that they can work together, triangulate, deliberate in a more inclusive manner if we're to be better prepared to respond to emergencies into the future. Thank you.
Thank you very much, Melissa. And now I'd like to come to Julian Tang. So Melissa mentioned there quite rightly, one of the features of the early UK response was this seeming from responses, particularly in Wuhan and elsewhere beyond Europe. So I'd like to ask you, from your perspective and your international experience, what you think we can learn from comparisons between Asian and Western approaches to informing COVID-19 responses with science. I think you're still muted, Julian, sorry.
Okay, so thanks to Melissa for laying out the ground so well. So the first thing I'm going to say is there's a lot of cultural snobbery in the UK about the types of evidence that they accept. And this has struck me very much coming back to the UK after working overseas for 10 years. So a study done in China is not as highly rated as a study done in Europe or the USA. A modelling study done in Southeast Asia, again, is not given the same weight as a modelling study done in the UK or the USA or Europe. And this has led to a lot of delays in realising that some of the early Hong Kong studies actually predicted that this type of pandemic could easily happen. The second thing that is a problem in the UK is that they don't have the experience. Okay, so they have experience of gene sequencing, viral sequencing for many years, clinical trials for many years, and vaccine development for many years, but they've never dealt with a on-the-ground pandemic at this scale, whereas Southeast Asia has, and the experience counts for a lot. So the experience feeds into the conviction that they're doing the right thing. Now, New Zealand got it right very early on because they went to Southeast Asia, they talked to a lot of experts there, and they decided to make the same decision as they did there to lock down universal masking, although that wasn't practiced in New Zealand so much. But that kind of response, that severe and serious response, was learnt by New Zealand. That's why they've done so well. The UK has played it down consistently from the beginning. John Oxford was on Radio 4 saying that, this is just a Chinese Asian virus, don't worry about it, we should focus on HIV, malaria and TB, they're the main killers. And he's not been on Radio 4 today's programme ever again. So there's a certain inherent cultural snobbery about the way things are done in the UK and the way things are looked at elsewhere overseas. I think this is ingrained since the Great British Empire of 100 years ago. Even on the media, when I've been giving interviews on the media, I talk about Taiwan, their response, Thailand, the response, Vietnam, the response. They don't want to hear it. They say, Julian, we're not Chinese. tell us about, what the UK people can understand. And in fact, most of our hospitals are staffed by Chinese doctors. Most of our hospitals are staffed by Indian doctors. Most of our hospitals are staffed by African doctors. Okay, so UK is a cultural melting pot, but the way they deal with the evidence, their policies, their weight given to the evidence is not actually international at all. I've seen this locally, and I've seen this at a higher level. Now, this is at government level. This is separate from the people on the street. I think the British public are actually much more tolerant than people expected. They will do what they're told to do if they trust the government messaging. And as Melissa said, several events occurred that made them lose their trust. But if they were told to basically mask, stay at home for 3 months at the beginning, looking at what's happening in China, Southeast Asia, and how it spread across to the West, they would have done it, okay? Children can wear masks in schools. I've had many interviews, I've shared many websites where children, primary school, secondary school, wear masks very happily in Hong Kong, Taiwan, China, Vietnam, Thailand, go to school fine with very low infection rates. Again, Melissa touched on this. They assume the public wouldn't tolerate this. They assume the children wouldn't tolerate this. They can tolerate this. The only difference is that Southeast Asian children have grown up with this masking culture since 2003, even before that, because of industrial air pollution. The UK has resisted this by assuming that people would not tolerate it. They assume that they will not entertain this. In fact, a lot of the public, I've been listening to Radio 4's Today program, plus asking any questions, any answers all year. I've never done that before, but every day I listen to this. And the public are clamoring for more strict restrictions. They've been doing this for the last 9 months. So the government has a disconnect from the people on the street and their own advisory committee. And their own advisory committee doesn't seem qualified to evaluate some of the evidence. For example, the masking. My research area is actually aerosol transmission and masks with respiratory viruses for the last 20 years in UK, Hong Kong, Singapore, and Canada. What I found amazing is that there are very good British studies done by the Health and Safety Executive from 2008 that show that masks actually work very well to contain the aerosol, as well as to protect from incoming aerosol. So it's two-directional. And no one's looked at this data. And so I sent a link to many reporters, and they probably publicized it. And in fact, the evidence is there. Masks are very good at containing aerosols. You can reduce it by 4 to 6-fold, and reducing incoming aerosols if you're masked for defense. And again, can reduce it 4 to 6-fold. So that can reduce a viral of 1,000 down to like maybe 40 viruses. The evidence is there. Then also the type of evidence. Some people say, well, that's a lab study, Julian. We don't trust that. We want a randomized controlled trial. RCTs are great for tablets. You take a tablet, placebo group, active group, test arm, and then you go about to your daily business. Masks are no good for random controlled trials. RCTs, you need to wear the mask for 8 hours a day while you're working, but then you go home and you don't wear your mask at home. So you could be exposed during your after work hours to the virus, and then you come back to work the next day, you're incubating, and then you get an infection 5 days later, and they say masks don't work. Unless you do a controlled study from 24/7, which is what Jonathan Van Tam did in Nottingham. I know Jonathan Van Tam and Chris Whitty. I did ward round to Chris Whitty when I was a junior doctor, and I've worked with Jonathan Van Tam as a professor in influenza whilst he was in Nottingham, from overseas in Singapore and also here. And he did a study called the Interdisciplinary study in Nottingham, where they used a lab strain of influenza, quarantined people in a hotel for 2 weeks, made them wear different levels of PPE to look at the transmission of influenza in that hotel setting with different levels of PPE. And in fact, he found no transmission whatsoever of influenza. Now, that is not reality, but it shows that a lab strain of influenza isn't reality. It doesn't represent seasonal influenza. And a hotel setting with enhanced ventilation doesn't really reflect reality either. So if you're going to insist on an RCT, randomized controlled trial for a mask, you're doomed to fail. All the RCTs for masks from the Canadian experience, from the Australian China experience, have shown that there's kind of very poor quality evidence, very poor levels of significance, because the attack rate changes when they do the trial, and or they can't do it versus placebo. They can only do it versus another mask because of ethical reasons. So it's not answering the question that we actually want to answer. The other thing that the UK has done really badly at is looking at aerosols. Okay, there's a tradition in the UK of 100 years of microbiology infection control showing that people only believe in droplets. They don't believe in aerosols. This goes way back to Chapin in the 1930s, who's actually an American infection control person, who did away with all this idea of miasmas. And unless you're a microbiologist, you won't understand this history, but it became droplets and contact, okay? This virus does not transmit through contact transmission from touching surface and touching your face. It doesn't do that, okay? And droplets, if you can inhale it, it's an aerosol. So the droplet argument, again, is fallacious. And in fact, we're negotiating with WHO on this level about this now. Had a meeting last week about this, and they're much more convinced about this now. So it's almost like there's a resistance based on tradition that is restricting the implementation of more severe, more restrictive airborne precautions, which people just don't want to do. And they don't want to do it by saying that masks don't work or it's not airborne. There's still a tweet from WHO on the Twitter feed saying that fact, COVID is not airborne, okay? And it's still there. They should probably remove it. So I think there's a lot of academic and cultural snobbery based on tradition and history in the UK that needs to change. And also the idea that the evidence here is better than elsewhere. That has to change as well, because you know what? Elsewhere's had an experience like Ebola in Africa, like SARS in 2003 in Southeast Asia, that the UK hasn't had on the ground. It's okay sending teams out there to help, but when it comes here, my Hong Kong and Singapore colleagues who looked to the UK for infection control teaching were amazed at what was going on here. They said, Julian, what is going on in the UK? You know, because I'm in touch with all of them. I said, you guys write the guidance for us, which we follow in Southeast Asia, but you guys can't control the virus yourself when it's in the UK. And they've had less than 1,000 deaths. UK's had over 100,000 deaths. So whatever icing you want to put on the cake, the inside is still rotten, because no other country in Europe has had so many deaths per capita, and the economic fallout hasn't been avoided either. So there's a fundamental change that needs to happen in the way that the UK government, not the people on the street, the UK government needs to look at evidence from elsewhere in the world and treat it equally. The other thing I want to touch on is the way that the UK almost kind of attacked the way the Russians rolled out their vaccine. Okay, so the Sputnik 5 vaccine rolled out, they were giving it to their people, like the Chinese were rolling out their vaccines, giving it to people without phase 3 clinical data. And then they suffered so much abuse from the UK media and some of the experts here. And when the phase 3 data finally came out from the Russian Sputnik 5, it was much better on paper than even the AstraZeneca. And now the AstraZeneca team, also AstraZeneca team, are working with the Russian Sputnik 5 team to improve the efficacy of their own vaccine. Now, I've done many international interviews with Russian, Chinese, different types of media, and they are kind of amused how the UK attitude to various products around the world is such that it's almost derisory, with actually very little evidence. Okay, so there wasn't phase 3 data, but when it came out, it's better than the AstraZeneca phase 3 data. Okay, the clinical trial design of the AstraZeneca vaccine was amazing. 3 different arms, 3 different combinations of placebo, 3 different combinations of intervals between first and second dose, no BAME population virtually, hardly any elderly population, and yet the UK MHRA approved it, which it would do. Okay, so I think there's a lot of bias in the way that the UK sees its own product versus how it sees other products, and that feeds into the misconception, the misunderstanding, and the kind of cultural differences that you see between how the UK sees itself and how other countries see it. And I think this has led to a lot of, I think almost like a lack of distrust, because the UK messaging has been, we're always doing better, we're always doing better than other countries. But in fact, on the ground, the death rate has not reflected that. The case numbers have not reflected that. Okay, and this is something that people need to look into for the next pandemic.
Thanks, Julian. Very, very provocative remarks, which is great. I just want to stay with you very briefly for a follow-up question. So you talk about the cultural snobbery, and I think that's something that will be recognisable to a lot of our audience, particularly those based in the UK. What I'd like to ask you is, given the difference in death rates that you draw attention to, have you seen any sign during the latter part of the pandemic that some of that snobbery is shifting? And whether you have or not, how do you think scientists can most effectively help to bring about this change, where Western governments in places like the UK do pay more attention to the science emerging from other nations, particularly in Asia?
So, I mean, CNN had the nice big headline saying, you know, maybe Asia got it right about the masks. And then Boris Johnson and his team said, okay, we should have learned more from Asia. So I think that realization came through around 6 months later. Okay. And then what happened is that the vaccine trials and the results and rollout predominated essentially. And then the UK went back to its usual kind of modus operandi that, you know, we're still doing the best, we're still rolling out things the fastest, and et cetera, regardless of, you know, a relatively low efficacy for the AstraZeneca vaccine and the kind of distrust that's been getting from European partners and elsewhere. And I think that has really grounded the UK in actually what's going on elsewhere and how they're being viewed. How can they improve that? I think a lot of this comes from the government. Okay, so I think the way the government started doing this pandemic, dealing with the pandemic, for example, there's one modelling team, Imperial College, Neil Ferguson's team. I've been on his course, so I know that team as well. Dominated everything. And then I have friends in London School of Hygiene and Tropical Medicine who kept arguing that that model wasn't any good. There are problems with that model. And I'm saying the Edinburgh teams arguing that those models weren't any good. They want to see the coding. When the coding finally came out, they really nitpicked it. And then now the London School team, like John Edmonds, are now being consulted more often now than at Neil Ferguson. Now, of course, he had his little mishap with his, you know, his girlfriend, whatever. So that lost a bit of, you know, face for him. But I think that the UK needs to be much more equitable about how it deals with different teams who are offering different solutions to dealing with the pandemic. Even in my field, the lab diagnostic field in virology, because I'm a virologist, everything was centralized in the PHE teams, and only they could roll out the positive controls, only they could roll out the protocol. But in fact, in the US, people are developing their own tests all the time. Same with Southeast Asia. Each lab can develop their own tests in Southeast Asia as well, although there is some centralization of the resulting and the testing and the sequencing as well. So I think the UK needs to be more equitable in how it rolls out different aspects of the evidence gathering machinery in the UK. And just to say one thing about the evidence is always moving. In this type of situation, it's moving very fast. So saying that you are aligned with the evidence is a bit of a misnomer. Okay, you can only do the best you can. And I think you have to be honest and straight with this, because if you say the model says this, the parameters in the model can change tomorrow. And then that model prediction is going to be wrong. So I think there's a certain there's a certain anxiety to maintain face, like not too many reversals. And the UK had lots of them. But also I think you need to have an openness that allows you to reverse in an open way that still maintains trust.
Brilliant. Thank you, Julian. Melissa, you've been nodding along there, so I do want to bring you in, and I want to move the discussion perhaps into this direction around uncertainty and the openness of people to dealing with that kind of uncertainty, because I think there has been a clear conflict, particularly here in the UK, but in other countries as well, between a government that wants to present a very definite, clear narrative, which is the way that it appears to think is the way to get people to do what it wants them to do in terms of following restrictions. And it's got scientists up fronting that messaging, but yet the science, as we've been hearing, that the messaging is based on is in itself, you know, is uncertain and, you know, open to different interpretations. So I'd just like to bring you in here and see how you think we could better account for that uncertainty, both in terms of the evidence that's used and in terms of explaining that to the public.
Okay. Well, happy to. So, I mean, I think part of the problem is that uncertainty is not treated as uncertainty. It's the constant effort in sort of government-led science advice is to try and reduce it to risk. So strictly speaking, you can imagine a situation of risk where you've got a number of possible outcomes and some probabilities between them. And that's the kind of standard way that modelling works. And you sort of sort out your probabilities and then you take a bet on how to move forward. But the problem is, in a situation like an epidemic and many other situations operating in the world, that's only one very small part of actually a much greater array of what you might call kinds of incertitude. So you've got real uncertainties where you don't know what the possible outcomes are and you don't know what the probabilities are. You've got areas of ignorance where you've got genuine surprises coming up around the corner. I mean, the new variants is possibly an example there in COVID, although one might have imagined that new variants would occur. You just don't know exactly when and where. And then you've got what colleagues and I have often termed ambiguities, where actually your uncertainties relate to people just having different values, different priorities. Is COVID as a disease the key issue, or is it actually about my livelihood and my life? And different people weigh up those in different ways. So we've got all kinds of types of incertitude in play. We've got a lot of very complex, fast-moving dynamics, as people have been talking about. It's what the virus is doing, how the virus is interacting with the public health measures put in place. There is how people are reacting in all their diversity and all their inequities and what everybody else is doing. And this is a situation which is absolutely not amenable, frankly, to any singular approach, and including any singular kind of modelling. So I very much, with Julian, found his intervention there on the controversies amongst models very interesting. But of course, as he's pointed out, models are only ever as good as their assumptions. Any model is always going to be partial. So I think the point is we need to have multiple models that are clear about their assumptions, but we need to complement those with other kinds of knowledge which can track what's happening on the ground and in these different arenas. And then we need a different approach, which is much more iterative and responsive, that doesn't say, okay, now we know what we're doing, here's the blueprint, let's follow it. Oh, whoops, that went wrong, we better reverse. But actually from the beginning is working in a more adaptive, ongoing way and being open about the things that are not known, being transparent about uncertainties, and adapting accordingly. And finally, I think one of the other kind of, I very much enjoyed Julian's comments about, as it were, cultures of science advice and broader cultures of snobbery about other places, if you like. But I think one of the cultures of science, certainly in the UK, is the assumption that the public can only deal with certainties, and that somehow people can't manage in a state of ignorance. So they need to be told very, very clear things, very clear information. And I think that is part of, so it's a misassumption. It goes with this whole kind of deficit model in public understandings of science, which assume that publics are kind of like empty vessels that just need to be filled up with good information and are also vulnerable to lots of misinformation. Whereas I think that actually just does people an enormous disservice. People are much more able to understand uncertainties, to evaluate different options, to appreciate a more transparent approach to if this then that. Roger Pelkey calls this a plural and conditional approach to science advice. And I think we can also deal with a plural and conditional approach to public engagement. Publics can really cope with that very well indeed.
Thank you very much. I'd like to come to Annett next, again, building on the theme really, because you mentioned at the start the challenges of ensuring that new and diverse voices can be heard in systems that are designed to respond to emergencies such as this. So I'd like to push you a little bit further on that and ask you how you think that could best be done, both from the perspective of different academic disciplines, but also that kind of citizen voice and citizen engagement.
Sure. I mean, as somebody commented in the chat, it's not surprising that people go to people they trust. We know trust is incredibly important to where we go seeking advice. But I do think we need to challenge that in terms of how we think about science advice. And as somebody else noted, some of this is about the academy itself, which is not particularly diverse. And so there are issues about how we build more diversity into the academy, particularly at senior levels, and support that. But also that when we're planning engagement activities and involvement, we are thinking more explicitly about the agenda around who is present. And some of that, I was thinking particularly about diversity and inclusion, including career stage and geography in the UK, making sure we have everyone represented. But it is also about those interdisciplinary perspectives that Melissa was talking about, that we know that most of the challenges we're facing require an interdisciplinary response. And there is a bit of a tendency, particularly in the UK, to fall back on biomedicine. There's a really interesting report on the biomedical bubble in terms of where we've invested our science spend, and to be looking for particular individual sources of science to answer questions. Where we've been doing some work on the kind of long-term response to COVID, we've been working really hard to bring interdisciplinary perspectives together. And it's so for some of those groups, they haven't had much experience of that before, actually talking across from people working on the built environment, for example, from a kind of architectural perspective, with people thinking from a social science perspective about the built environment. And we need much more space for those kind of interdisciplinary discussions to inform policy thinking going forward. We've been much too quick to fall to kind of our individual disciplines or individual types of science.
Thank you. And I'd like to come back to Lawrence at this point as well, because you were talking about some of the cultural issues at play in Sierra Leone and West Africa and the kind of lessons learned from Ebola. So I wondered, in your advisory committee, or the types of advice that's being drawn on by governments, did you notice, or has there been a particular shift in the types of advice that are given and in those mechanisms between the two crises? And is there something there that might help audiences from other countries to learn about how they can adjust those systems?
Yeah, thank you very much, Sarah. Yes, I mean, our role has developed as a result, like I was saying, as a result of our experience during the Ebola time. And you know, during the Ebola, like all of us know, it took us unawares. We didn't know much about epidemics, you know, like that. And like I said earlier, there was confusion here and there regarding even the case definition. So, I mean, the structures that were supposed to be there did not come until very late during the response. So all these issues informed are the ones that are informing our decision. For example, when we heard that there was some disease in Wuhan in China, and especially when WHO announced it as a public health emergency of international concern, what we did was we immediately recommended the revitalization of those pillars that were there earlier. And the government, I mean, gladly agreed with us, and we now deploy people, we now deploy the scientists, the relevant scientists in each of those pillars. And that could be responsible in part to why we did not see a high level of infections right from the beginning. You know, I mean, when you compare that to Ebola. Because the pillars we are reactivated, and the government now was more responsive. You know, there was a high level of accountability. So when we told, for example, when we advised on government on the use of resources, for example, where those resources were best needed, you know, how those resources could be coordinated. And those initial thoughts that came from the advisory council, we are taken on board, and they were implemented as we suggested. So those were the issues that actually helped, you know, that helped the response to put the COVID response at bay, I mean, in terms of infection. But over and above that, I also want to believe that there were a lot of missed opportunities during the Ebola outbreak. For example, that which has to do with local ownership of the response was absent. And that is one of the things that we have kind of emphasized in this present advisory group. The local ownership of pandemics or epidemics are important. If the people that you are dealing with, or if the people that are going to be involved in the response are not kind of regarded, like you have some kind of a top-bottom approach, you will have the response, for example, overwhelming. You have the disease overwhelming the population, but that does not happen this time around because of the experiences that we learned from the Ebola. Now we knew that for example, the local authorities were relevant. You know, for example, the paramount chiefs and their sub chiefs were relevant in local responses, because this was a pandemic and it needed local response. So the local people were fully involved. So all these dynamics, like I was saying, played out a lot, and therefore we did not get the kind of disease expansion that one would have expected because of our past experiences.
Great, thank you very much. Right, I'm now going to come to some of the questions from our audience. We've had lots sent in so far, which is brilliant. So thank you for those. Do keep sending your questions into the Q&A box, and I will try to take as many as possible in the time we have remaining. So the first one, which is to all panelists, is how do you balance the need to make fast decisions during a pandemic exacerbated by the political environment and the demand for good evidence that may not always be present or available? So I'm going to come to Melissa first of all.
Okay, really good question. I think there are probably two quite practical responses. One is to generate platforms and mechanisms whereby existing knowledge, which is often out there, collected by previous social scientists and researchers, or in the minds and experiences of communities or local situations, can be brought into the hands of responders in real time very quickly. And just one example, at IDS we host with partners at the London School of Hygiene actually, and Virologist, the Social Science and Humanitarian Action Platform, which does exactly this and has been producing rapid response briefings through the course of the COVID outbreak. But I think the other really key mechanism is to have an open channel through your main science advice bodies and decision-making bodies to hearing in quite an iterative real-time way from diverse scientists, from diverse community members, and actually to perhaps organize your structures of science advice in a more open and responsive and decentralized format. I think this is something that Annett would have a lot to say about, but the research is ongoing. And thirdly, you can actually commission, I mean, there are ways of doing quite rapid research and evidence gathering in the middle of an emergency, and those have a role to play as well. So I think there are very practical ways forward here.
Brilliant, thank you. And I would like to come to Annett next on this point.
Yeah, I agree with all of those things. I think particularly this issue about existing knowledge, we have a real tendency in our research funding systems to assume if we need research, that we need new research to be commissioned and conducted, and the time lag is just makes that not fit for purpose in these kind of contexts. And so we can definitely do more on that. I think the only thing I would add is I think for me, there's a bit of recognition if we're working with decision makers of what it means for them to be in those situations of uncertainty, and a bit of recognition about how difficult it would be to be making those decisions. And so when it comes to engagement and partnership, that feels like an important part of the piece, is to be feeling that people are certainly, some of the work my colleague Paul Kearney's done going back over the SAGE papers is to see what it meant to be in that situation of making decisions at the start, and to that, you know, we don't actually have to make those decisions. So a bit of recognition of that, I think, as part of the package.
Thank you. And Julian, if I could come to you next for your perspective on this, and are there examples you could give us of where you've seen this done particularly well or indeed badly?
Yes, I'm a virologist, so my examples are from virology. So let's go back to HIV, 1980s. The evidence for that was is in gay men, MSMs we call them now, and that the heterosexual population weren't really at risk. And then we saw heterosexual cases arising in Africa, where actually the virus came from, and then we changed our narrative. But this is a slow spreading virus. Let's forward track to 1999, the West Nile epidemic that went from Israel to the US. That was slightly more fast spreading, more quickly spreading encephalitis, but again, relatively few cases for every 100 cases, maybe one case of encephalitis. And then going forward to like the SARS 2003, the pandemic flu, avian flu, and now COVID-19, there is evidence out there. If you look for it, in virology, we call it kind of homology testing. So we get the sequence, we sequence the virus, we look at the different fragments of the RNA. If they match other viruses, We know the function of that RNA, that protein. So we can actually infer fairly accurately what this virus is doing. The classification is a coronavirus. We know coronaviruses behave in this way. And yes, kids do get infected. They are reservoirs for respiratory viruses. We know that for all the other viruses. Why would they not be for coronavirus? So there's a so-called, not just the evidence you see now, but there's a preconception, there's a history of the rationale behind some of what you're seeing that can be used to infer what we should be doing. So for example, when we said that, oh, it's spreading between people in Wuhan, okay, but it's not spreading yet between people outside of Wuhan. Well, why would the virus stop spreading between humans, whether the virus is in Wuhan or outside of Wuhan, okay, or outside of China? And this is what separated the fake public health emergency of national concern versus pandemic declaration. So we can infer certain things, knowing some of the basic biology about these pathogens to do the right thing. And there is aerosol transmission for all these respiratory viruses. Why would there not be for COVID-19?
Thank you very much, Julian. And if I could come to Lawrence, finally on this question, if there's anything you'd like to add from a West African perspective.
Thank you very much, Sarah. I just wanted to add a little bit to what Melissa and Annett were saying regarding existing knowledge. But I will want to speak on that with some amount of, just draw the attention of Melissa and Annett to some caution. For me, existing knowledge, yes, that's good. But what kind of existing knowledge? What are the because some of this knowledge that is got, for example, from one community or one country cannot be applicable. So I will suggest, for example, which ones can we draw? What existing knowledge, which best practices, can we craft out of those existing knowledge, for example? Is it applicable to my reality here? Can it really work the way it should work? Because we should be mindful of the fact that we work in different environments. There is this environment that is fully, resourced with everything. There is this one that is impoverished. So when we are looking at existing knowledge, what is the level of this existing knowledge that we are going to use, for example, in Sierra Leone? It can definitely not be the same that has been used that has been used in UK or the US that has to be used in Sierra Leone, because the dynamics are different. The environment is different. So we want to look at those existing knowledge, the best practices of the existing knowledge that is really that can be implemented in Africa, or that can be implementable in Sierra Leone, taking every other thing into consideration, taking the economy into consideration, taking our politics into consideration, etc., etc. So that's the addition I wanted to make.
Thank you, Lawrence. Okay, moving on to the next question. So we've talked a lot about the kind of preference of policymakers to follow certain types of evidence. Alan Stanley asks, what is it about mathematical modelling type evidence that makes it more attractive to policymakers than studies that focus more on local, cultural, social knowledge? Where shall I start? Annett, let me start with you.
I was hoping you wouldn't come to me first. I think this is a really important question for us to ask about, and it's a bit about asking more fundamental questions about the kind of range of different types of evidence we need to answer complex policy questions, and a recognition from a funding perspective about the funding is very disproportionate between these approaches. I think from a policy perspective, often what we bring as I'm a social scientist is often unpacking issues, making them more kind of complex and challenging. And as Melissa said, things that need kind of debate and discussion. And that can feel a bit frustrating when you've got really difficult decisions to make. Not that it's not important and that we should be doing more of it, but I can kind of see, I guess, the appeal of the sort of superficially definitive looking answers that come out of some of the modelling work. In terms of supporting decision making. So I think it's a really interesting question. I think some of it is about thinking about what types of evidence we value for the future, and where we invest in kind of different types of science to help us with the complex challenges we face.
Thank you. And Melissa, you may well have a view on this and how we can best promote those other types of science in future.
Yeah. Well, I think I mean, I think Annett is certainly right in what she says. I mean, I would agree with those points about mathematical modelling. It gives one an illusion of clarity, of singularity, of control, possibly, and of kind of single answers or sort of clear ways forward. But actually, those just aren't up to it in a world that is inherently messy, and that's the problem. So sometimes the control that one seems to get through these models is illusory and can in turn be quite dangerous. I mean, I think the other thing I would say is that the sort of cultures of I mean, institutions have sort of co-developed with the reliance on this kind of evidence, which is why we see it as so dominant, not just in the UK and in government, but in the World Health Organization, in the Centers for Disease Control. There's a whole kind of history of the rise of epidemiology and certain major state institutions and indeed global institutions, which in turn we're now seeing played out in these very technocratic approaches to disease preparedness and response. And that isn't undone overnight at all, because there's power and money and resources wrapped up in commitments to certain kinds of science and knowledge and ways of doing technocracy. But I think it can be chipped away at through the kinds of discussions and debates we're having now by many people working in other ways. I think sometimes you get openings when things go really wrong, actually. So this is, I mean, in the West African Ebola example, it was only when the model-driven top-down response went really pear-shaped and people started being violent towards health workers because they didn't like their burial practices being undone, and when the big Ebola treatment units that were being built because a CDC model had said there would be hundreds of thousands of deaths weren't needed, that actually then there was an opening to think differently and look to other forms of knowledge. And I think we've seen that just a little bit with COVID. I mean, partly in response to one of the other questions. I mean, I think the approach in the UK COVID response in SAGE incorporated some social science from the beginning, but it was very, very narrow. It was sort of behavioral science. It was kind of nudge theory specialists, certainly not the anthropology, the political economy that we'd seen, for example, even brought in by Chris Whitty around for the West African Ebola response. And I think part of the reason for that was the UK was felt to be manageable and controllable, and we only really needed behavioural science, whereas anthropology had been valuable for Ebola because it was telling the UK responders about other places. There was a kind of exoticization of why anthropology in this case might have been useful, as well as things going badly wrong. But interestingly, the turn to anthropology and some of the softer social sciences in the COVID response has come around things like problems of vaccine hesitancy. So we have this super successful rollout, but there are some populations who don't seem to be so confident and so trustful. So it's there that kind of, again, now anthropologists have been brought in more directly to go out and do some community level work and find out what's happening. So that's not a good reason. That's not the, I mean, the positive view would be to say we need to embrace multiple knowledges from the outset. I think in practice, spaces sometimes open up when the pitfalls of the standard mathematical modelling informed approaches really become apparent, and then decision makers go help, and there's then more space for other kinds of knowledge to come in.
Thank you very much, Melissa. I'm going to move on to another question now, as we do have so many coming in. So this one's to Julian. Following your comments earlier, what do you think is the implication for the UK's reputation, credibility, and the innovation and investment that's going to be made in this country in terms of setting standards and dealing with outbreak responses and healthcare measures when, as you know, as the statistics show, initially at least, there was a failure to control the virus on a pretty huge scale?
So which part of the world is this
I can't tell you where it comes from because it comes from an anonymous attendee, whether deliberately or not.
Okay. So to some extent, I think the UK has to learn from its experience. So it is like the child who gets his hands burnt, okay? And that's had this experience, just like now, like Southeast Asia, it's in the same kind of boat. They know what to expect next time, what can happen. And I think the last question about mathematical models, I think there was too much emphasis on that. I actually review them. I have a PhD in applied fluid dynamics as well. So I review a lot of mathematical models as well. And their main problems, their assumptions are not time varying. They're fixed. So the result of the model can change very dramatically. So if you look at the previous models from Neil Ferguson, for example, his predicted mortality of foot and mouth and CJD were wrong by magnitudes, orders of magnitudes, because those are time varying parameters that will change over time. So I think the UK needs to move away from this emphasis on modeling only, which is basically what we've been seeing throughout the whole year. And I think some of Melissa and Annett's comments are relevant to that. I think also they have to consult more widely, not just a certain group, and also message in a much less binary black and white way. Because if you message in a very binary black and white way, if you get it wrong, you look like an idiot. Okay, if you say, we're not sure about this, like right now, the third lockdown, coming up the third lockdown now, I think this is the way to do it. One step, 4 or 5 week break, see what happens. Next step, 4 or 5 week break, see what happens. But they've learned this after 12 months of actual, fairly public agony, okay? So I think there are things they can do, and I think a different government may have done this in a different way. This is a very populist government. If this was, say, Margaret Thatcher, she would have said, okay, look, we're going to lock down for 3 months. No one's going to argue. We're going to see what happens because, that's what the Southeast Asian countries are doing. So let's do the same thing because they know better. And she would have used a cast iron lady approach and actually held that in place. And at the end of 3 months, the numbers would be far smaller than what we had coming out of the first lockdown. And that's much easier to control. Track and trace is much easier, much more straightforward, much more effective. So you need a very strong government who's convinced by this kind of approach from the beginning. And again, this comes with experience, not just on time-varying evidence.
Thank you very much. Okay, moving on to another question. So we've heard a lot today, obviously different perspectives around the best use of evidence, and you're all scientists. So where are scientists wishing to influence evidence use during an emergency best placed to do so? Is it from within the government advisory functions to become part of the panels such as SAGE in the UK, such as the group that Lawrence is part of in Sierra Leone? Or is it on the outside where perhaps you can speak more freely, where you can have a media platform using social media and gathering a following there, speaking truth to power? Annett, I'll come to you first.
Well, I would always go with the working with the structures that are in place to support governments, partly because I think those are your opportunities to have more influence. But also I think that you learn a lot from that about what it means to make decisions, and that comes from working with governments or with communities at a local level. And the more we understand where we're coming from as different stakeholders in society, the more I think we can work effectively together. It doesn't mean I don't see there as a role for people standing at a distance and commenting. I think that is part of the plural society, and that there's a value to that too, and it does allow people maybe a bit more independence in their voice. But from a personal perspective, I guess the research I do is all very applied, and so I'm really interested in using any opportunities I can to kind of learn about how that might be useful and used, and to do better research in the future that speaks to kind of what we need to know.
Thank you. And I'm going to come to the others in a moment, but just to stay with you there then, if, as we've heard, there are some disciplines whose evidence seems to be less valued or historically has been less valued in emergencies by governments, if you're a scientist working in one of those disciplines and you take on board the idea that you want to be close to decision makers to present your evidence, but there doesn't really seem to be that much of an opening for you to do that, how does that scientist best get involved in those structures, or best make the case for their involvement in those structures?
So some of that I think comes for people who do already have some of that influence. That one of the things when we're kind of encouraging science to engage with policy and practice is to help people develop the skills to do that better. We know stuff from what people have been saying today about how to be better at that kind of work and how to do it in a kind of more effective way. And that as part of that, I think when we speak for science, as social science, wherever we're coming from, we can speak for the different perspectives on those issues, and we can help to encourage people making decisions to look and think about those different perspectives too. You know, if we do work in particular areas, we often read and think about those other perspectives. So I think there is some work that we can do to make that more effective. And then I think there's a bigger agenda with funders like UKRI to kind of really be pushing this agenda around interdisciplinary contributions to solving complex policy problems.
Thank you. And Melissa?
Yeah, so I agree with Annett that I think government structures are critical, and I think more generally that goes with the view that state responses to emergencies are critical, and that's something that we've really learned, I think, through COVID. But it's state responses of a certain kind which need to be inclusive and need to build trust. And that's where I think I might depart a little bit from Julian's assumption that the cast iron lady approach is necessarily going to work. I think actually an emergency like a big epidemic is a major test of state-citizen relations and of an inclusive and accountable style of politics. And that's what we need into the future. And secondly, that I think we have to be not just centralized, we need to think about decentralized state functions and bodies, which is something Annett also said. And in COVID, as we've been discussing, I mean, the roles of local governments, municipal authorities, often in much more effectively around in other parts of the world than in the UK, actually, where they've been undermined by lack of resources and lack of funding over many, many decades, have been incredibly important. So could we look to a future where we imagined forms of science advice and decision-making bodies that better link sort of the central and the decentralized, and connect up those formal bodies with actually citizens' voice and forms of local knowledge. So it might be that you have citizens' juries or deliberative assemblies in your locations, which then feed through views to your science advice bodies. And finally, I think actually there's one positive story out of COVID, certainly in the UK and to some extent globally, which is actually about media. So the media hasn't just been in a combative role. I think there's actually been some incredibly good, well-considered, investigative and kind of dialogue-based, debate-based science journalism over the course of this pandemic, and that's something to be encouraged. And I think perhaps a more transparent and fluid relationship between what goes on in formal science advisory bodies and what's happening in the media, where public debate is happening, is what we need. Certainly we need to get away from an idea that government advisory bodies are all happening behind locked doors and creating secret decisions which are then imposed on the rest of us. We actually need something that's much more transparent, much more accountable, and much more inclusive.
Thank you. And Lawrence, perhaps you could give us your perspective here, because obviously you were speaking earlier about the issues with trust and authority. So from your experience, do you agree that scientists working within government structures are still the best place to influence, or does that in a way taint their evidence in the eyes of the public, and how would you see that best working?
Yeah, thank you very much. Well, you see, the issue of science working the way it should work in a highly polarized country is a politically polarized country is something that we have to take into consideration. You know, I mean, the groundwork is done that people should believe that science is important in emergencies like this. But because when people are in power, for example, they are, I mean, these are glaring things that are happening here. For example, government in, government out. When they are in power, for example, the focus is usually on on, for example, the area where they have the highest, for example, votes. So in circumstances like that, it's becoming very difficult for people, for example, to trust the science, So until, for example, that is seen to be put aside or to be shown that it is never the case any longer, there is always going to be distrust in science at whatever time, during whichever government that is in power. So that's just the fact. So we have to be a little careful as to the role of science in this instance. Because, for example, when you take over as a government, you want to, like in a pandemic like this, you want to be very sincere about how things should go, and then you collect or you appoint the best brains, for example, to give it. People still look at it from a different perspective. And therefore, when it comes to, say, implementation, like I said earlier, when it comes to adhering to some of those pieces of advice that have been given by this very, very high-profile committee, people, you naturally have people not adhering to it. You definitely have people, working behind the backs of these people. So it's a little complex situation in Africa. It's a little complex situation, especially in Sierra Leone. And on those issues, those polarizations are worked on, and for people to believe, to begin to build trust in governments that come and go. It's going to be a little difficult for science to thrive in emergencies.
Thank you, Lawrence. And Julian, you're someone that obviously has been very vocal in the media around the pandemic. So from your perspective, better to be in or out in terms of influence?
So my background is very varied though. I have different perspectives from different parts of the world, having worked there. I think that if the government teams can actually diversify and actually go and see how these other countries work, they may have different perspectives to bring back to the UK that might be useful. Certainly when I was working in Singapore and Hong Kong, all the epidemiologists there, the public health teams, actually had to go overseas for 1 year. They were funded to go overseas for 1 year and work in different countries around the world and bring that experience back. The larger Western countries don't have this obligation, US, UK and Europe. They just stay within their own little silos and do things the British way, the French way, the US way, Canadian way, et cetera, Canada does have some of that actually. So I think that if the UK becomes more diversified, not just in terms of ethnicity and culturally, but in that kind of experience overseas, then that would be much more useful. And I can see from Annett and Melissa's approach, it's a very British approach. So I wouldn't feel comfortable in one of those SAGE UK government committees because my experience and my perspective is quite different from someone like, say, Melissa and Annett, because I've worked elsewhere overseas and seen the different cultural and academic approaches to doing different things there, as well as the social responses locally. And I think if there's more of that diversity of experience, not just of cultural ethnic backgrounds in the UK government advisory committees, which are mostly white, to be honest, white British, will actually be beneficial to the UK, especially with an international pandemic like this.
Thank you very much. And I'd just like to come to perhaps Annett. So you've heard Julian say there he wouldn't feel comfortable being part of those groups. And yet we've heard throughout the discussion today that we ought to be, every country, but particularly the UK, ought to be learning more from other countries' experiences and from different disciplines. So what would you say to people that feel, as Julian's just articulated, that that's not the best place for them to be putting forward their advice?
Well, my feeling is it's not for people like Julian to be having to think about how to change to fit into those structures, but for a bit more thought to be made about how they can be more inclusive. And actually there's some kind of thinking going on within government a bit about that. So for example, the work we were doing on trying to do some more inclusive dialogue work involves, kind of a lot more preparation and giving people some support to participate in those processes where they want to, and thinking about some of those challenges about how the work is done. And one of the advantages to some of the kind of more online style of working that we've been doing, not for good reasons, but doing over the last year, has meant, I think, that there's been a bit more scope for people to come in and experience some of these environments and then participate. So I think there are some things that, from a structural point of view, need to be done to make it those processes and more kind of amenable to more participation going forward. And I absolutely think this issue about kind of drawing in international perspective and having less of a kind of imperialist view of what counts as good knowledge, and how we do that learning, as Lawrence was talking about from his context, how we learn from other countries is incredibly important going forward, particularly for things like this, but for many other kind of challenges we face as well.
Thank you. And I'm going to come on to one final question very briefly, because it follows on quite nicely from that answer, is how realistic is it really to hope that decision-making bodies like governments and research funders will allow for the kind of shift of power that values bottom-up evidence generation and also experiences from elsewhere? The example given in the question was the Global South, but it could equally be Asia.
Sorry, who's that to?
So I'm going to go with Annett for now, please.
Realistic? Maybe not, but that's definitely the dream. I think this is incredibly important, this idea about, you know, what knowledge counts, how we draw on that experience. I think we have to be kind of pushing this narrative all the time. So I'm always talking about, for my work, is about evidence use, how much can be learned from my world about work that goes on in the Global South in terms of much more participatory approaches to evidence generation. And so to be constantly pushing those messages and also showing where that's made a real difference. And so I think we're at the beginning of a journey on this, but I think a really, really important thing to be thinking about going forward. The masses of learning about more participatory approaches that is a long way from the practice we have in the UK at the moment.
Thank you. And Julian, how realistic do you think it is that that decision-making bodies will change to value this kind of knowledge more?
Well, I hope it'd be better after this short shock over 12 months. I don't know. It depends who's in the lead. It depends who's leading that particular body, that institution. I think somewhere like, you know, Francis Crick may have a better chance of doing this than, say, you know, SAGE, which is very much, you know, UK government led. Francis Crick's more international. So it really depends on who's the lead in this situation and what their experience is. The phrase I've heard the most in this 12 months is there's no evidence of ABC. You've got to find out what the evidence is. What do you see as evidence compared to what do I see as evidence? And that perception differs between your experience, your expertise, and also your personal view. It's not objective at all. When I say maths work, let's say maths don't work because they want an RCT. I don't want an RCT. I know the lab results are fine. So that kind of perspective, that kind of phrasing, messaging, I think is very important. And we've seen good examples throughout the whole year of this, where one person's evidence is another person's fluff. Okay, so I think that is, trying to get a consensus on that is going to be very difficult, almost impossible. But I think that will guide how different institutions apply the evidence in different ways.
Thank you very much. Right, well, we're nearly at the end of our session, so I'm going to stop there in terms of the questions, but I think we will have them written down, so it may be that some of the panelists can respond individually if they have further things to add in response to some of the questions that have come through. From my perspective, I think this has been a really interesting discussion, obviously huge amounts to talk about, but I think some of the themes that have come out around the importance not only of the structures that are in place for scientific advice, but the mix of people on them and the way that that advice at the outset is put in place to enable better decision making in crises such as the one that we've all been facing, is something that we need to learn from going forward. And I think some of the lessons we've heard from West Africa are particularly pertinent in the comparison between the Ebola crisis and COVID. So I'd like to thank you all speakers for your participation today, and also for all of the questions that have come in. Thank you very much for joining us, and I hope to speak to you again soon. Thank you.
Thank you.